Hello, I'm Dr. Lane Cook, and I'm a psychiatrist in Knoxville, Tennessee. I'm the owner of TMS of Knoxville, Transcranial Magnetic Stimulation Clinic, and I'm also the Chief of Psychiatry at Cornerstone of Recovery. And you may be watching this video because you happen to be a patient at Cornerstone of Recovery. So today I would like to talk to you about attention deficit hyperactivity disorder. Now, I use the terms ADHD or ADD interchangeably. There's really not a whole lot of difference. Most of the symptoms are the same. Most of the treatments are the same. Males tend to have more of the hyperactive type. Females, the inattentive type. But you can have hyperactive girls and inattentive boys. So it's really not that important. Some people think of ADD as the inattentive type and ADHD as the hyperactive type. So let's talk about it. What is ADHD? Well, ADHD is interest-based attention. You can pay attention if it's interesting, exciting, challenging, relevant to you, or scary, or there's an immediate deadline. If it's not those things, if it's not one of those categories, and you're not on medication, or in some cases certain drugs that tend to help ADHD through their dopamine and norepinephrine properties, such as heroin, cocaine, opana, methamphetamine, then it's hard for you to pay attention to those things. And for my patients who are trying to recover from addiction, this is very, very critical, because when you can't pay attention to something, you experience it emotionally as boring. And boredom is a huge trigger for people with ADHD in recovery. Now, boredom can be an issue because it's not always fun and exciting and challenging. And you may be on no medications or no drugs, and so you have to work a little harder to stay enthusiastic about things. Sometimes what happens to people that I have seen is that, especially people that go back to their hometown, and maybe they live in a small town or even a medium-sized town, and there might be only 2 or 3 or maybe 4 different AA or NA meetings, and they go and they've heard the same stories over and over, and they know everybody there, and they can pretty much kind of predict what's going to happen in those stories. And guess what? They get bored. And what do? They get complacent, and they say, you know, I'd rather do anything than go and hear Jimmy and Freddie's stories again, so I think I'll just not go. And that's the first step of relapse. Sometimes, going to another city and going to different meetings. I've known people with ADHD who were alcoholic and not drug addicts at all, never even done drugs, who like going to the NA meetings because they're, to be frank with you, a little more exciting. Some scary stories and wild and craziness happens that may be a little more entertaining to that person than an AA story. So this interest-based attention also means that you got to keep your recovery very, very fresh. And like I said, go to different meetings. There are plenty of in East Tennessee, we have something called Serenity in the Smokies for recovering women. And there are lots of different things that you can do. Go camping with sober friends, bowling with sober friends, with maybe some people in your AA or NA groups. There are things that you can do to make yourself stay excited about being sober. Now, why do we have this in the gene pool? It turns out that the theory that made the most sense, that got proven, was first proposed by Thomas Hartman, who's a psychologist. And Dr. Hartman had a son who was diagnosed with ADHD, and they talked about it from the deficit standpoint. Well, they have trouble paying attention. They have trouble, maybe they fidget a lot. Maybe they have easy distractibility, squirrel. They're looking at different things, checking their watch, checking their phone. I've taken mine out of my pocket. And They have trouble finishing things. They procrastinate. They wait till the last second to do everything. They have difficulty waiting their turn. They interrupt people. They have to go back and read things over and over again because between the first sentence of a paragraph and the last sentence, or the last sentence on the page, their mind has gone off in 14 different directions, and that's a problem. So he thought about this, and he said, my son's a really neat little kid. He's very smart. He's funny. He's inventive. He thinks outside the box. So Hartman was, the story goes, he was reading about how grasses mutated to grains after the last ice age. He began thinking about evolution, and he said, I got it. The people with ADHD were the hunters of our society. The people that weren't hunters were the farmers. Farmers are patient. They can wait for months for stuff to grow. They deal with frustration like droughts and floods. They're not impulsive. They don't plant beans on Monday and on Wednesday dig them up and plant corn because the beans hadn't come up. But the hunter has a very different skill set. So imagine that 100,000 years ago, when we were still in the Stone Age, that I'm a farmer and you, the person watching this video, is a hunter. And you say to me, I think there's some rabbits out in the tall grass. Let's go get some, and let's split up. And I said, okay, so you go this way and I go this way. We both hear something rustling in the grass. We both head there, but then we don't hear anything. Well, I'm a farmer. I'm patient. I can wait. So I just sit down and hope that the rabbit comes back. He doesn't. You, on the other hand, you go this way, but you don't hear anything, but you hear something this way and you go there, and then you go there and you go there. So after a while I come out and I say, hey, I haven't caught any rabbits. You go, I got 4 rabbits. Well, that's distractibility, which is great if you're hunting. And in fact, one of the genes that's associated with ADHD was studied in a group of nomads in Kenya who half of them had split and gone into the cities to work, and half of them stayed in the bush. Well, if you had this gene, in other words, you had ADHD, you were better nourished in the bush. But if you had that gene in the city, you were less successful. Why? They were probably doing boring jobs, like working in, factories or shops and things like that. And so that trait of the hunter of being easily distracted led to better nourishment. They were better fed. So we're headed back to the tribe. And I say, hey, I dug up these roots. I got some orange ones, some brown ones. They're too soft to make weapons out of them. What do you think we can do? And you say, well, let's put them on the fire and cook them. I go, well, that might be dangerous. I don't know, I don't know. And you go, well, I'll eat the first one, or we'll get Thor to eat the first one. That's impulsive, but it's also inventive. You come up with a carrot and a potato. Or we're going back and you go, hey, you see those 4-legged things? I've been watching them. I bet you I can ride one and we can get places faster. I go, that looks really dangerous and foolish. You go, hold my rabbits. And you ride a horse. That's impulsive, dangerous, risk-taking, but inventive. Now, suppose we come across deer tracks. Now, deer tracks are different because it takes a long time to track down a deer on foot with hardly any weapons. But you're such a good hunter that I follow you, and we spend quite a while tracking that, maybe hours, and we finally catch it and you kill it. Now, in ADD lingo, we call that hyperfocus. That's an absorption phenomenon. It's like putting blinders on a horse in the city. A good example is playing a video game. People say my son couldn't have ADHD because he can play a video game for 10 hours straight. And I go, how about his English homework or algebra? It's like, 5 minutes, he's gone. Interesting, not interesting. So the hunter-farmer theory got proven by some genetic scientists back in, published in 1992, and they were looking at these genes that affect what's called the dopamine transporter, and in the dopamine 4, which is one of the 5 different types of dopamine transporters, the most common one that was actually came about before Homo sapiens is 300,000 years old. We're only about 200,000 years old. And it was the DRD4 repeat allele. There are certain parts of the gene that repeat. Well, so there was another one called the 7 repeat. And this one was much younger. It happened somewhere between 45,000 and 45,000 years ago. And they can tell that the way that it came up in the population, that it wasn't a chance mutation, a random one, but it was in fact, let's say, a survival of the fittest, a Darwinian type of gene, and it increased in the population. ADHD is the most genetic psychiatric disorder we have. If you have it and you have an identical twin who has the same genetic makeup, that twin has about a 70% chance of having it too. Why isn't it 100%? We don't know. But it's greater than any other psychiatric disorder, including addiction, schizophrenia, depression, bipolar, panic attacks. ADD is the highest one. It acts as a dominant gene. If you have it, you got it from mom or dad or both. And the chance that you're going to pass it on to your child, if you have a child with somebody who isn't ADD, it's about 40%. If he or she has it, it's about 70%. It's much better to treat it early on. And so what happens is this attractive gene built up in the population. Well, that would be obvious the moment that you and I, the cavemen, came back and we're looking for girlfriends, and and you're riding a horse, you got 4 rabbits, potatoes, carrots, and a deer across the horse, and I'm going, but I can grow wheat in 3 or 4 months, and they don't give me a second look. So now farmers made it, we didn't get totally crowded off the planet, because it turns out you can sustain more people on an acre of land farming than you can from hunting. So we actually kind of crowded them out. And so Hartman wrote this book called ADD, A Different Perception. And in the foreword of his book, Will Crinan, who was a missionary doctor with the caribou hunters up in the Arctic Circle, said that the young men that were the very best hunters were the worst students. So if you think that having ADD means that you're a loser, you're wrong. You're just a hunter. And what happened is that he discovered with his son, and he wrote a second book called the Edison Gene, where he talked about Thomas Edison, who would have been diagnosed ADD by anybody these days. But he had a passion, his mother homeschooled him, he had a passion for inventing. Now, he was smart and got people to finish a lot of these projects. He didn't test all those filaments in the light bulb. In fact, he stole it. And we call those today completers. And lots of millionaires and billionaires who have ADD and think outside the box have an idea and say, why don't you try a few 100 ways to do this, and finish them for you. So it built up in the population, and lo and behold, about 30,000 years ago, we finally got out of the Stone Age, and technology exploded thanks to you and your ancestors. And we got fancier weapons, the bow and arrow, the spear thrower called the atlatl, invented the wheel, domesticated animals, and you're looking at me right now on something that was invented by people with ADHD. And so they think outside the box. And thank goodness for those people. And the treatment has to do with, learning skills, ways to deal with procrastination, with impulsivity. And I especially am concerned about that with alcoholics, because I think that alcohol is not typically a craving drug, not like cocaine or heroin or meth or opioids. And many relapses with people with ADHD with alcohol is they're just in the wrong place, the wrong time. As we say in the program, people, places, and things. And you've mowed your yard for 6 months now without a beer, but that one day it's really hot, and maybe you saw a beer commercial and you think, I think I'll have a beer, and before you know it, you've relapsed. So impulsivity is a problem there. So boredom and impulsivity are things that you really have to watch out for. And having a good support foundation is extremely critical for that. So people with ADHD, stimulants continue to be the most successful treatments in adults. There are non-stimulants such as Strattera, or atomoxetine, which is not a controlled substance. It's not quick. It takes 4 to 6 weeks to work. Has some side effects, but it's not a controlled substance, and it's not prohibited by like railroad companies, etc. sometimes we'll use a couple of blood pressure drugs called clonidine and guanfacine for people that have a lot of moodiness with ADHD. People with ADHD have bottle rocket mood shifts. Psst, psst. They get really mad real fast and they're over it in 5 minutes. Now your spouse may not be over it, or the guy you just punched may not be over it, but you are. And they're sometimes misdiagnosed as bipolar for that reason. But bipolar mood swings last for days to weeks, not moments. So the difficulty with ADHD is getting diagnosed, getting appropriate treatment, learning to manage it. I strongly recommend a website called howtoadhd.com and the YouTube channel by Jessica McCabe, who's a young woman who had ADHD herself, got medicated, but still wound up getting divorced and failing at life. And she said, there's got to be something more than taking a pill. And she dived in very deeply and spent a couple of years learning everything she could about ADHD. And she's got over 100 videos on YouTube, and I strongly recommend them. And I show people how to know if you're ADHD. And most of these are designed for people with ADHD because they're 5 minutes or less. So I hope that helps you. And it's important to understand that we owe a lot. We owe a huge debt to people with ADD. They've made our lives so much better. So, thanks.